Hello, everyone. My name is Brendan Kelly. I'm an acupuncturist and Western and Chinese herbalist, speaking to you from Vermont in the US. And what I wanted to discuss today was anxiety and fear, and using Western herbs to treat each condition individually, as well as talk about the possible direct connection between anxiety and fear. And I think that those diagnoses are very relevant now. I'm not sure where everyone is watching from, but here in the US and here in Vermont, which is near the US-Canadian border, there is a lot of anxiety and there is a lot of fear. And I think part of that is based on the reality that we all now face, which is based partially on COVID and the effects of COVID here in the US and around the world, and also really all the change that we're going through socially, ecologically, politically, and in my opinion, that change is of urgent need. And in times of change, there can be a response of anxiety and fear. So, as I see it in my work clinically, talking about anxiety and fear is very, very relevant. And a little bit about me. As I mentioned, I am a Chinese and Western herbalist. My first training was in in Western herbs, and I have been incorporating Chinese herbs also over the last 20 years or so of my clinical practice. And really what I've been doing for about 18 of those years is really integrating Western herbs and Chinese medicine. And I think that that integration is really important, is really relevant, because I think it's of assistance to both traditions. Looking at the Chinese herbal tradition, it is really rooted in the traditional and the indigenous understandings in China and in Asia. And so the lineages in Chinese herbal medicine goes back thousands and thousands of years. So that's an incredible strength that we can draw on when talking about herbal medicine. But I believe that what herbal medicine in China and in Asia now, at least as it's permeated to the US, is experiencing is really a loss of connection to the actual plants. There's a lot of really wonderful, very successful practitioners of Chinese herbal medicine here in the US who don't know a lot about the actual plants. They're not rooted in a hands-on understanding of herbal medicine. And I think what us in the Western herbal tradition, in many ways, we are still really rooted in that hands-on relationship, that hands-on connection to the plants. But I think what we have lost is our clinical roots. We've lost the traditional and indigenous understandings of wherever we come from, that people and herbalists have been talking about the use of plants for thousands and thousands of years. And I think that that's what we have lost for the most part as Western herbalists. So what I've been working on for the last 17, 18 years is the integration of these two things. The integration of the hands-on connection with plants, which I'm still a part of. My training as a Western herbalist included a lot of hands-on work with plants, wildcrafting, medicine making, gardening, farming, and combining that hands-on understanding of the plants with the traditional and the indigenous understandings of Chinese herbal medicine. So I think that that integration is really of service to both traditions. And practically speaking, it really is very effective clinically. That a hands-on understanding of plants allows us to really have a relationship with the plants, which is a strength of Western herbal medicine. And the old traditional indigenous understandings from China and Asia really connect us to the understanding that dates back for a long, long time. So that being said, I want to talk specifically about a Chinese medical idea of anxiety and fear. And I think that's very relevant now, and hopefully we can take some of these ideas and apply it to other situations, because in Chinese medicine, it's not enough to just have a symptomatic understanding of what's going on. For example, anxiety and fear. That's really the beginning of the discussion. That's not the end of the discussion. Because what we really emphasize in Chinese herbal medicine is a differential diagnosis. What we want to understand is how we can differentiate what's causing the symptoms. Very, very, very important. Because an analogy in Chinese medicine, including Chinese herbal medicine, is that there are roots and there are branches. The roots are where the symptoms are coming from, and the branches are the symptoms themselves. So we want to understand the branch, which is the symptom, and as best we can, we want to understand the root, which is where the symptom is coming from. When we do that, we can both be effective as herbalists in treating things symptomatically, as well as a deeper long-term level. Because symptoms really are just the messengers. Symptoms are just telling us that something is out of balance. So symptoms are not bad. Even all the political, social, ecological issues that now confront us, those are not inherently bad things. They can be difficult things, they can be challenging things, but they're not bad things. A symptom is just trying to get our attention, whether it's a large global symptom or an individual symptom in the treatment room. So with that understanding of roots and branches, we really want to try to understand where the diagnoses of anxiety and where the diagnosis of fear comes from. And in doing that, we can not only treat, again, the branch, but we can be treating the roots as well. So in my understanding of Chinese medicine is really influenced by the 5-phase tradition called Wu Xing. And Wu Xing is also called the 5-element tradition. That was my first training in Chinese medicine, and I have expanded on that training, and I incorporate lots of other different traditions as well. But I would say that really the oldest intact medical view we have in Chinese medicine is the 5-element view, is the 5-phase view. And that view goes back to a text called the Neijing, the Yellow Emperor's Classic. And that's really, as I see it, a seminal text, the seminal text in Chinese medicine, partially because it's very, very old. According to a Chinese medical view, it goes back about 4,800 years. So that's predating Western civilization, literally. But it's also a view that has been really consciously and unconsciously incorporated into Chinese medicine for a long, long time. So it really is a foundational basis for Chinese medicine. And part of the significance of the 5-element view and what we're talking about today, which is anxiety and fear, is that built into the 5-element understanding is that we are physical, mental, and emotional creatures. And built into that in particular is that each of the yin organs, so in Chinese medicine, there's yin and yang, each of the yin organs that we're going to discuss today has an emotion associated with it. So in terms of what I understand the conference is about, which is talking about psycho-emotional issues and how herbal medicine can address that, Chinese medicine's way, or a Chinese medicine way, of addressing psycho-emotional conditions is to understand which organs are associated with which emotions. So there are 5 elements, 5 phases, and there are 5 primary emotions. So, and those emotions are specifically connected to organs. So built into the Wu Xing 5-element, 5-phase understanding is that the way we treat emotions is by understanding which phase, which element is associated with each emotion, and then understanding the organs that are associated with those elements. So all of the emotional issues that we may be seeing in ourselves, in our community, in our clients, and our patients, those are absolutely potentially treatable. And the good news about it is we have this wonderful model. We have this model that has been used for several thousand years to help us understand where emotional issues are coming from. So for those of us who want to understand how to treat psycho-emotional conditions, how to understand the connection between psycho-emotional conditions, physical conditions, and how we can use herbs to address it, the 5-element, 5-phase model of Chinese medicine really is an extraordinary model to use because built into it, embedded in the Chinese medicine understanding of the 5 elements, 5 phases, is the psycho-emotional connection. So we're going to talk about issues of anxiety and issues of fear, but all the emotions that we see and we experience are talked about in this model, in the 5-element model. So when we talk about emotions, we are talking in Chinese medicine, we're talking about treating the organs associated with those emotions. And there is a direct, immediate interconnection, a well-developed interconnection between the physical, mental, and emotional aspects of our lives. So again, it's in Chinese medicine, we're trying to treat the roots and the branches. And so we want to understand where the symptoms are coming from rather than just treating the symptoms themselves. So when we talk about anxiety, for example, I'm going to discuss why I don't think that anxiolytics, that anti-anxiety herbs, for example, are a complete method to addressing anxiety. And I think herbs like anxiolytics that we're going to talk about a little bit can be part of the picture, but they're not necessarily the whole picture. So I'm going to talk about incorporating Chinese medical ideas with Western terms like anxiolytics to hopefully present an idea about how we can treat things like anxiety and fear. So in thinking about this wonderful 5-element model, this Wu Jing model, we're going to focus on a couple of the elements in particular. We're going to focus on the water element and the fire element. And the fire element is about yang, and the water element is about yin. Because in terms of yin and yang, which is also a very embedded part of Chinese medicine, the yang is the upper part of who we are and is yang and is warmth and fire. And the lower parts of who we are is about the yin and the water and the coolant. So one way to understand anxiety is, which I think clinically is the most accurate way in what I have found, and we treat a great deal of psycho-emotional conditions at our clinic. So we definitely have found these 5-element model, the Wu Jing model, to be very effective. One way to understand, I think the most effective way to understand anxiety is that it's excess yang, excess warmth rising up into the chest. And it rises up into the chest, and it affects the heart. Because the heart is associated with the fire element, and so the heart is prone towards having heat. And the way to understand and the fire element, the heart is associated with joy and love and connection. So one way to understand anxiety is that it's essentially excess joy. Now in the West, we maybe don't think of that in that way. And we say, well, if some joy is good, then more joy is even better. Not necessarily, because things are always about balance. Things are always about maintaining an equilibrium internally. And so when we think about joy in Chinese medicine, joy is about the chest and about the heart in particular, and having the heart expand and radiate warmth out into the world. And excess of that can be called anxiety. So again, we always want to be maintaining balance in our own lives and in the lives of the people that we work with. So the emotion associated with fear, the organ associated with fear is the kidney. And the kidney is associated with the water element. So the fire element is in the chest. The water element is the lower part of our body, really from essentially the belly button down. So there are lots of different kinds of fear. In my opinion, there's only one kind of anxiety. That's what I have found to be true clinically. And that's when there's excess heat rising up into the chest and disturbing things. But with fear, there's many different kinds of fear. And the kind of fear that I want to talk about is the fear that happens from a lack of yin. And the yin, again, is the coolant and the relaxation. So the kind of fear I want to talk about is what we'll call yin deficient fear, or yin deficient heat fear. So if we break down the term yin deficient heat, the yin is the coolant and the relaxation, and the heat is the overstimulation. So one way that we can get yin deficient heat is when the heat is too high in the body and things are overstimulated, and the coolant, the sense of relaxation, gets cooked off. So why in my view, there is only really one clear way to understand anxiety, which is heat in the chest. There are different kinds of fear in Chinese medicine. And the reason I want to talk about yin deficient fear is because I think there's a direct connection between anxiety and fear. And the 5-element model really allows us to understand that. And the connection can be when things are overstimulated, when things are hot internally, the heat can rise up into the chest and create anxiety. But with that heat, as I mentioned, the coolant can get cooked off. And the lower part of the body is associated with that coolant, that sense of relaxation, that sense of peace. And because the kidney is associated with the water element, and the water element is associated with the yin, when the heat is rising up into the chest from an excess of heat, that can affect the coolant and the yin in the lower part of the body. And as the water element and the kidney are associated with that coolant, it can affect the kidney as well. So another way of saying that is we can have an excess up here. We can feel anxious in the chest. And we can also have a lack of relaxation in the lower part of the body, in the yin, and that can create fear. So rather than thinking about anxiety and fear as two things, we can think of it as a manifestation of one thing, which is an excess of heat. And there are many different views, many different traditions in Chinese medicine. And part of what I'm going to be talking about is the tradition that really has influenced a lot of the work that I do clinically, which is the school of heat. And it's called the Wenbing. And I think the Wenbing is very, very relevant because it is the tradition that emphasizes heat and the importance of understanding and addressing heat for addressing physical, mental, and emotional conditions. So the Wenbing school, the school of heat, really emphasizes heat and its understanding to translate the Eastern view into a Western perspective is that heat physically is inflammation, and heat mentally and emotionally includes overstimulation. So if we're treating a hot condition, the school of heat, the Wenbing, in my view, is the very appropriate one to look to. So we're going to be incorporating some ideas from the Wenbing, and we're going to be translating those ideas into the use of Western herbs. So from this Wenbing view, this school of heat view, one place that the heat can originate from, again, we're talking about roots and branches. So one root issue for heat can start in the stomach, can start in the gut. And the reason for that is because the stomach, in particular, by its nature, is hot, because it needs to be hot, because the stomach has to have acid to be able to metabolize food. So one view coming from the school of heat is that the heat can start in the stomach and or return to the stomach. So this is really significant because if we have hot conditions, we can look diagnostically for heat in the stomach. And so one way from a Chinese medical view that we could diagnose heat in the stomach would be pulse and tongue diagnosis. And we don't have time to get into that, but for those of you who do pulse and tongue diagnosis, if you look for heat in the stomach in the tongue and heat in the stomach in the pulse, you will often find it because the nature of the stomach is to be hot. And the stomach is associated with the earth element, with the harvest season, which is the 5th season from the Wu Jing perspective. So what can happen is the heat can originate in the gut. It can originate in the stomach. And then the heat, by its nature, because heat is yang, the heat will rise up into the chest and contribute to anxiety. But also what can happen is when there's excess heat in the abdomen, as I mentioned before, the heat in the lower burner, in the kidney area, can get burned off. So the heat can start here, create anxiety. The heat can consume the yin, the coolant in the lower burner in the kidney, and that can create yin deficient problems, a lack of coolant, and that can in turn create fear. So really what we're talking about is heat that can originate in the earth, in the abdomen, and the heat comes up to the chest, which affects the fire phase, the fire element in the heart. And when there's excess heat in the abdomen, in the stomach, that can pull the yin out of the lower burner and affect the kidney. So we're really talking about 3 of the 5 phases, 3 of the 5 elements. The earth element, which is part of the abdomen, the fire element, which is the chest and the heart, and the kidney, which is the lower burner, which is the water element and the yin, the basis for yin. So that gives us a little map of what we can be looking for with issues like anxiety and with fear. So one interesting diagnosis from a Chinese view to describe anxiety is called running piglet syndrome. And as is often the case, Chinese medicine has this wonderful metaphorical way of understanding things. And so running piglet syndrome is when it feels as if there's little piglets in the abdomen and they run up to the chest. And so people will describe that. They'll say, oh, it feels like things are in the abdomen or right underneath the rib cage on the upper abdomen. Things are really anxious there, and then it bubbles up to the chest. And my understanding for the likely cause of running piglet syndrome is heat, right? The heat builds up in the abdomen, it creates pressure, and then the little piglets are let out and they rush up into the chest. So there are images that are used in Chinese medicine to describe what's going on. Another term to describe anxiety, again, would be the Chinese understanding called Shen Disturbance. So the Shen, all of the 5 elements, have spirits associated with them. Chinese medicine is an inherently holistic understanding. So the spirit of the heart is called the Shen, S-H-E-N. And when the Shen is disturbed, we get Shen disturbance. And Shen disturbance roughly equates to significant psycho-emotional conditions. There's a lot of other things that can cause significant psycho-emotional conditions, but Shen disturbance is one of them. And so one of the major reasons that the Shen, the spirit of the heart, which is in the chest, is disturbed, again, in my opinion, in my clinical experience, comes from heat, because the heat rises up to the chest, disturbs the heart, disturbs the Shen as a result. So Shen disturbance is another term that we can think about in terms of anxiety. It doesn't mean that Shen disturbance equals anxiety. It just, anxiety would be within a category, a potential category of the larger term of Shen disturbance. In thinking about fear, as I mentioned, there's lots of different kinds potentially of fear. There can be fear from yin deficiency in the kidney, which we're going to be talking about. There can be fear from yang deficiency in the kidney. So there's lots of different qi deficiency in the kidney. So there's different ways of thinking about fear. I want to focus on the one that I see most often and that I think relates most clearly to anxiety, which would be yin deficiency in the kidneys. And also there is a direct connection between the heart and the kidney, between the excess heat in the heart that creates anxiety and the potential yin deficiency that creates fear in the kidney. And that's called the heart-kidney axis. And the heart-kidney axis is an axis, it is a line, it is a relationship between what happens in the chest, in the upper burner, and the lower burner, which is the kidney. And so we can say that what happens in the kidney affects the heart, and what happens in the heart affects the kidney. So with that understanding, that line, that axis, we can again have a way to conceptualize how something like anxiety in the chest can affect fear, which from a Wujing Chinese medicine view originates in the lower burner, which is the kidney. So the connection between those, again, between fear, yin deficient fear, and anxiety is this heat. And so that's very significant because it is a way to potentially, hopefully, be able to try to treat both at the same time. So if there is this connection between anxiety and fear with a diagnosis of heat, which I very much believe there is, and we're going to talk more about it with herbs in a little bit, but if there is this connection of heat, which I believe is likely to originate in the gut, then I think it's very, very important, I would go so far as to say essential, to talk about really basic things that can affect heat in the upper burner and yin deficiency in the lower burner. And so diet is really important. Herbs are important. If you practice other forms of natural medicine, I have no doubt that those remedies are important. But for me, clinically, diet is essential. Diet, I think, is at least 50% of what creates success with folks feeling better, at least 50%. In many cases, it's even more than 50%. So if we can differentiate what's causing symptoms, and then we can understand what foods can contribute to those symptoms feeling better or feeling worse, then we're really far down the path in helping someone to feel better. So if there is this connection of heat between anxiety and fear, which I believe there are, then it's really important to talk about foods that are hot and warming, as well as foods that are cooling. So to start with, and I understand that not all herbalists will agree with this, or even want to hear this, but I feel the desire to share it because I think it's so relevant clinically. The number one thing, in my opinion, that contributes to heat in terms of food in the West is coffee. Coffee, without exaggeration, is overstimulation in a cup, or with what we're talking about now, it's anxiety in a cup. Coffee is so uniquely overstimulating. I wrote a book on climate change, a Chinese medicine understanding of climate change. And I thought coffee was so important to this discussion of what's happening globally that I wrote a whole chapter about coffee. So if you want to get a more in-depth understanding of my opinion about coffee, you can just read that chapter in my book. Chinese medicine knew about coffee. My research from the book indicates that in about the 1300s, the 14th century, coffee was introduced in China. By the 1500s, the 16th century, there had been enough understanding about coffee to write about it. And it's very interesting because Chinese herbalists really were in consensus at the time, which is rare. There's a tremendous diversity in Chinese medicine, tremendous diversity in Chinese nutrition. So it is not always the case that there was a consensus. But by the 1500s, 16th century, a lot of the famous physicians of that time, of that era, were writing about coffee. And their consensus was that coffee had almost no upside, which again is interesting because Chinese medicine thinks a lot of things have upside, a lot of weird substances, gecko and the feces of flying squirrels and fossilized bones, as well as all kinds of weird plants and weird animal parts. So the fact that there was consensus about this and that there was thought to be so little upside of coffee is really, really important because coffee is uniquely overstimulating. It's uniquely hot. Now, I can imagine that some folks are saying, including some herbalists are saying, well, there's benefits to coffee. It increases circulation, increases blood flow to the brain. Yes, it does that. And the way that it does that is introducing an enormous amount of heat to the body. So not only with anxiety and fear, but in general, I do not think that coffee really has any place in our overstimulated Western culture. And specifically with anxiety, it contributes directly to anxiety because you drink the coffee, it goes into the gut, and from going to the gut, it goes up to the chest and creates anxiety. And that's the dynamic of coffee. Coffee just lifts things up so significantly that it ungrounds the energy and can create anxiety. So some other things that are not so good with anxiety in particular, but all of these suggestions are also relevant with yin deficient fear as well, because anything that's hot and stimulating in addition to rising up to the chest can cook off the yin, the coolant, and affect fear as well, and encourage fear, create fear as well. So other foods to avoid with this heat associated with anxiety and possibly associated with fear would be all spicy foods. So that includes onions, garlic, ginger, cayenne, nutmeg, cinnamon, turmeric. And I can already imagine what some herbalists are saying to that. But those things are good. Ginger is good. Cinnamon is good. Onions are good. Garlic is good. All of those things can be good if someone has cold. But if someone has heat, that they're not good. In fact, they're contraindicated. So again, we want to differentiate the diagnosis. We want to, rather than saying this thing is good and this thing is bad, ginger is good and cinnamon is good and nutmeg is good, we want to understand the nature of the substance and we want to understand the nature of the diagnoses and see if they match. And with anxiety, those things do not match. People say, well, ginger is good. Ginger is good if you have cold in your stomach. Anxiety does not indicate cold in the stomach. Anxiety almost certainly indicates heat in the stomach, and the heat rises up to the chest and creates anxiety. Folks can probably say, well, cinnamon is good. It promotes circulation. Correct. It does promote circulation. And what cinnamon does, cinnamon twigs in particular, guija, because the cinnamon bark is considered a different herb, but guija, cinnamon twigs, what it does is it warms the body and it lifts the heat up and out. Well, that's what anxiety is. Anxiety is too much heat being brought up and out to the surface. So cinnamon is not good with anxiety. Chicken is also really warming and lifting, and turkey is hot. So chicken and turkey would be contraindicated with anxiety. And I can imagine some of the thoughts now with saying that, well, chicken and turkey are good. It depends on the person, right? We're trying to differentiate what's causing the issues that people have. A substance that could be really good for one person may not be really good for another person. Also with anxiety and with fear too, we want to avoid all refined sugar. It doesn't mean that the sweet taste is bad. Sweet taste is actually associated with the earth element, with the stomach and the spleen. White sugar in particular is so hot and overstimulating that it's very likely to lift the energy up. Some honey and maple syrup are fine, but refined white sugar is particularly not good. Next, really warming category of food would be fermented foods. Now, this one may also create a response. Fermented foods are good for us. Fermented foods promote digestion. They do. And things that promote digestion usually warm the stomach, right? So again, fermented foods may help some people, but if you have an excess of heat in the gut, which is my understanding of where the anxiety comes from, then you do not want to warm the stomach. You can promote digestion. There are herbs, Western herbs and Chinese herbs, that can promote digestion that are not warming. So we don't want to overstimulate the gut with anxiety, because I think in many cases the anxiety is coming from overstimulation in the gut. And what we want to do, in addition to avoiding or eliminating those foods, is we want to increase cooling foods, right? And so we want to increase foods that clear out heat and that are moistening. So leafy green vegetables in general do that. Lettuce does that. Bok choy is really often used in Chinese nutrition because it's cooling and moistening. And the moistening part is relevant for the yin deficient fear that I'm talking about. Also, with the understanding that anxiety is too much energy going up, things are getting unrooted, people are feeling anxious. In addition to not ingesting hot foods and ingesting cooling foods like leafy green vegetables, we also want to introduce foods that are rooting, that are heavy, that kind of bring the energy back down. So an excellent food for that is pork. I can imagine if some folks are vegetarians or espouse a vegetarian diet, that may not be popular, but it is really relevant because red meat in particular is considered to be heavy and rooting. And pork is neutral in temperature. And pork actually is known to build up the yin. So with the fear in particular, the yin deficient fear that I'm talking about, that's exactly what we want to do. With the anxiety, we want to root the energy down. And so that rooting can help with the anxiety of the pork, but also with the heat rising up, that can affect the yin. And so pork is a wonderful remedy because it roots things down. It's not warming, it's neutral in temperature, and it tonifies yin, which can address the deficiency in the yin that can create a certain type of fear. Beef is beef is also considered heavy and rooting. It is slightly warming, and it tonifies blood, which is not exactly what we're talking about, but blood is a fluid and yin is a fluid, so beef can be very relevant. And a lot of fish is also relevant as well. Fish is usually maybe a little bit warming, but a lot of it is neutral and cooling. And because fish are in water, fish tonifies the yin, which again can affect the overstimulated kind of fear that I'm talking about. This is a general statement, but we want to encourage our clients, our patients, to eat natural foods. GMOs are not so good. All the chemicals that are used to produce the non-organic foods that folks eat can create heat and inflammation in the body. And I believe heat is a cause of what we're talking about. So that's relevant. And with anxiety and yin deficient fear in particular, you really want to encourage people to live a relaxed life. Our lifestyle in the West, at least here in the United States, and I assume in other Western countries as well, is a hot lifestyle. It's overstimulated. We're too busy. We're on our screens too much, right? We're watching and typing on the computer too much. We're watching electronic entertainment too much. So part of the remedy is diet, but part of the remedy for yin deficient fear and anxiety is just decompressing. Just allowing the mind, allowing the emotions, allowing the chi, the energy, to quiet down. So that is absolutely relevant as well. Ideally, even though these are stressful times, we want to encourage people to not internalize the stress too much. There's nothing wrong with stress, but stress can contribute directly to heat. So we want to have people limit that. Doesn't mean we're pretending that the world is any way other than what it is, but I do not think it is of service to the world in these really overstimulated times to become too overstimulated ourselves. So promoting a sense of peace, a sense of relaxation. And if we want a balanced, sustainable world, we have to be balanced and sustainable internally. So limiting stress and something really simple like sleep. In the Neijing, the text that I was talking about, the Yellow Emperor's Classic, it talks in the very beginning about the importance of diet and lifestyle. And it says that in a balanced state, my interpretation of it, of what the Neijing is saying is in a balanced state. We want 8 hours of sleep, 8 hours of work, and 8 hours of doing other stuff, family and self-cultivation and other things. But that's assuming that things are balanced. If someone has heat and overstimulation and a lack of yin, a lack of coolant, really more sleep is likely required. So with anxiety, heat in the chest, and yin deficient fear, the fear that comes from not being settled and rooted, I think it's very reasonable to suggest 9 to 12 hours of sleep a night. And that can seem unlikely or impossible to us in the West, but that's because we're so hot and we're so yin deficient. Just the thought of laying around can seem foreign to us. But even if people can't sleep that whole time, for them to sleep as much as they can and just lie in bed. So I would say a real minimum with anxiety in particular would be being in bed for 9 to 10 hours a night. And if you can't sleep that whole time, or your client or your patient can't sleep that whole time, that's totally fine. But just laying down is cooling and also cultivating the yin, bringing in the sense of internal peace and sense of internal relaxation. And in general, with anxiety and with the yin deficient fear, we just want to do less. We just want to slow down and be less active, less engaged in the external world so that we can cultivate our well-being internally. And even with these difficult and stressful times, I think that is of urgent importance. In Chinese medicine, looking again at the text in Neijing, what's happening in the world around us is understood to be a reflection of what's happening in the world internally. So if we want to be of service to the world around us, we have to be of service to ourselves internally. If we want to change the world around us, we have to change our own internal landscape. If we don't do the internal work, the internal cultivation, it's very likely that in our desire to be of help to the world, we're just going to be recreating pathology, right? And we are an overstimulated, hot country here in the US, and wherever you're listening or looking at this, I assume it's similar for you as well. That with all the stress, all the overstimulation we have, a sense of internal peace, a sense of internal quiet is a fundamentally essential remedy for us to be able to transition to a more sustainable and just and healthy world. So one way to do that is just do less. Slow down, do less, rest more, take more naps, and then we'll think about all the diet suggestions that I described, and then we'll talk about herbs as well. So now what I want to transition to, I want to talk about is a little discussion about herbs for anxiety in particular. And what I want to start this with is, in my opinion, I don't think that anxiolytics are enough. So anxiolytic is a term that describes substances, in this case herbs, that can deal with anxiety. And the reason I don't think that's enough is because a lot of the common, not a lot of, almost all of the common herbs, substances that are talked about, at least in my understanding of Western herbalism, to address anxiety are warming. So an anti-anxiety remedy that is warming is not likely to be treating where the anxiety is coming from. So I think anxiolytics, herbs, can be relevant, but I do not think that by themselves they are treating both the root and the branch. Anxiolytics to treat anxiety, I think, are much more of a branch issue. They can be combined with more cooling internal remedies to make a nice formula. And again, Chinese herbalism is inherently holistic. So Chinese herbalism is based on formulas. It's very, very rare. It's almost 0% of the time would we use an herb by itself. We would use herbs with other herbs in formulas. So if anxiety is coming from heat in the stomach that's then rising up into the chest, a really important place to start is to treat heat in the stomach. And so the Western herb I use a whole lot for that is Echinacea. Echinacea species, the root in particular. And I use purpurea. I know some folks use angustifolia and other species. I like to use purpurea because it's easiest to grow, and we have some growing here in our gardens, and that's just the one I like to use. Echinacea is cooling, and it's cooling for the stomach in particular. And part of, I think, Echinacea root, what it does is it releases some heat up and out. It's a mild diaphoretic. It mildly creates sweating, but mostly I think what the root does is go down. It sends the heat in the stomach down, which is really, I think, essential to understanding and treating anxiety. We could also use an even more cooling herb like golden seal, right? Hydrastis canadensis. And that's even more bitter than Echinacea, and it goes down. It's not, I would say Echinacea is cooling. A golden seal is cold and bitter. The bitter taste in Chinese medicine means that it descends. And so something like golden seal strongly sends the heat in the stomach down. So those could be, Echinacea and golden seal could be combined. So I'm obviously not talking about Echinacea and golden seal in terms of colds and flus. We don't use Echinacea golden seal by themselves for colds and flus. We combine them with other herbs. I'm talking about using Echinacea and golden seal more for internal remedies, which in my opinion is usually clinically a better match. Another herb that can be used for sending heat down, because again, anxiety is coming from heat that's up in the chest, would be willow, the Salix species. And I got this idea from Peter Holmes, who wrote the Energetics of Western Herbs books. And he said that willow, in his writing and his experience, was similar to the Chinese herb mutang, akebia. And akebia has this very unique, in my view, very unique niche in Chinese herbalism, in that what it does is it takes heat in the chest and sends it down through the bladder to be relieved, to be eliminated. Because heat in the chest, if we're talking about heat in the heart in particular, there is no direct way to clear heat out of the heart. What we actually have to do is take the heat from the heart and send it to the small intestine, because the heart and the small intestine are paired in the fire phase. So we have to take the heat from the heart, send it to the small intestine, and then there's a direct pathway from the small intestine to the bladder. The bladder is also associated with the water element, the water phase. The heart and the small intestine are paired in the fire phase, and the bladder and the kidney are paired in the water stage. So if you have heat in the heart in particular, the way to get rid of it is to send the heat from the heart to the small intestine and from the small intestine to the bladder so that things can be peed out. And so this is important in Chinese medicine, at least the older parts of Chinese medicine. If we have a pathology, if we have an imbalance like heat, we want to physically get rid of it. We don't just want to move it around. We don't just want to make it less. We want to physically understand the pathway that we're going to use to get rid of that imbalance, that pathology. And so mutang, akebia, is the herb that takes heat from the heart, sends it to the small intestine, and then sends it from the small intestine to the bladder so the heat can be peed out of the body. And Peter Holmes says that in his experience, willow bark is very similar to mutang, akebia, and I have found that to be true. So what I believe what willow does is it takes the heat in the heart and encourages it to be passed out through the bladder. So you're peeing out the anxiety, literally. Some other herbs that can be used for anxiety are going to be diuretics. So again, the logic for that is heat in the heart is anxiety. The heart is paired with the small intestine, and the kidney and the bladder, which is the fire phase, the fire element. The bladder and the kidney are paired in the water elements. We want to take the heat and pass it from the heart to the small intestine to the bladder to be eliminated. So diuretics, they clear heat out of the bladder. So, and you can feel this in the pulses sometimes, where there will be a lot of heat in the heart, and then the bladder is not functioning properly. The bladder isn't able to eliminate as effectively as it could. So using diuretics is a way to clear the heat out of the bladder, which could in turn help with the heat in the small intestine and then in the heart. So diuretics can be an effective way of addressing anxiety. So the ones I use would be plantain leaf or seed, Plantago species. And around here, we usually use the broadleaf plantain. You can also use the narrowleaf plantain. I think that they're interchangeable. I use the broadleaf because it's more common around here and it's easier to get. You can also use another diuretic like corn silk. That's to differentiate corn silk and plantain. Plantain is a drying diuretic, and actually corn silk is a little bit of a moistening diuretic. Corn silk is kind of juicy when it's fresh, but you can use other diuretics as well. And so we talked about herbs like Echinacea, golden seal, talked about willow. Now we're talking about diuretics. Now, I believe we could use anti-anxiety herbs, or what's considered anti-anxiety herbs that address the heat in the heart. we can use those in conjunction with the other herbs that I spoke about. And so I would say anti-anxiety herbs include valerian, Valeriana officinalis, hops, kava kava, and those can all be used. But as I mentioned before, all of those are warming. If the anxiety is coming from heat in the heart, using a warming remedy may be effective in one respect, but it's not going to be curative because it's not getting rid of the cause of the anxiety. So I would suggest thinking about ways of getting rid of the heat itself and then combining those herbs with something that could be more symptomatic in terms of addressing the anxiety. So one way to understand the anxiolytic herbs of valerian, hops, and kava is that they go down, they're settling things, and in particular, we could put them in the Chinese category of settling spirit. And in particular, the spirit that they're settling is the Shen. So they're settling the Shen. Again, the Shen is the spirit in the heart, and when the heat rises up, it can disturb the Shen, creating Shen disturbance. So one part of the category of herbs called settle spirit are herbs that are going down, that are sending the anxiety down. So those herbs can be part of a formula. Okay, next I'd like to transition to herbs that I think can be used for fear, but we're talking about specific kinds of fear, in particular yin deficient heat fear. And so yin deficient heat fear is the fear that happens because there's not enough coolant internally. In addition to the overstimulation, that is the heat, there can be a lack of yin, a lack of peace, a lack of quiet. So it's the jumpy fear. It's not the fear that comes from kidney yang deficiency, which is kind of a cold, shut down fear. This is yin deficient here, where people are jumpy and kind of freaked out all the time. So to kind of connect the herbs and the perspectives about anxiety to this yin deficient fear, most of the herbs that we talked about already can be totally relevant, because my experience, clinical experience, is the heat can start in the abdomen, go up to the chest, and the heat in the abdomen also can cook off the yin, and that can contribute to fear. So Echinacea absolutely can be relevant because it's cooling and it's primarily sending the heat down. Golden seal could be relevant as well. It's more than cooling. I would say it's cold and it strongly goes down. Diuretics absolutely can be used here. We're using plantain seed, plantain leaf to get the heat out of the kidney in this case, but it can also obviously, as we talked about, be used for heat in the heart and other diuretics as well. You could absolutely use settle spirit herbs, right? Because it's relaxing. And one issue with yin deficient heat fear is people are kind of jumpy and kind of popping out of themselves. So using anxiolytic herbs that, from a Chinese view, again, we can say they settle the spirit. All of that absolutely could be relevant as it's going down. But the herbs I would add when we're talking about yin deficient heat fear are herbs that specifically tonify the yin, right? That are going to bring in the coolant, that are going to bring in the sense of relaxation. So two Western herbs that we use a lot of from a Chinese view would be burdock, Arcticum lapa. And burdock has a really, I think, important niche in what we're talking about, in that it's cooling and moistening. I very much believe it's a yin tonic. It tonifies kidney yin and stomach and spleen yin and lung yin. So there's three burning spaces: the upper chest, the abdomen, and the lower burner below the belly button. And I think that burdock goes to all three of those places, and it's cooling and moistening. So it's a yin tonic, a cooling yin tonic, but it's not so heavy, so it's less likely to create dampness. So burdock can be used for the heat and the yin deficiency with this kind of fear we're discussing. And another good friend of ours is nettles. I believe, this is my interpretation based on reading and using a whole lot of nettles clinically. I believe that nettles tonifies kidney yin, the coolant in the kidney, and it also increases liver blood. So when we talk about blood in Chinese medicine, a lot of the time we're talking about liver blood. There's also different kinds of blood, but liver blood is also a fluid. So there's a relationship between between the blood and the yin. So nettles, I believe, tonifies kidney yin and liver blood. It is slightly warming, but that's okay because sometimes some things that are warming can have a cooling result. So even those nettles is warming, I believe it tonifies kidney yin, which is cooling. And I think that nettles is similar, I believe, to shu di wang, the revered Chinese herb prepared Romania, but it's not as heavy. And so it's less likely to create problems in the digestive system and less likely to create dampness. So nettles could be used with burdock or by itself to bring the coolant into the lower burner, into the kidney, to create a sense of relaxation and with peace. And the other herbs that we talked about can be combined to make a formula. So I hope that was useful. I hope that was relevant. And I very much believe in my training and in my clinical experience that the herbs can help us profoundly in these challenging times. They can heal us at all levels. They can heal us in body, mind, emotions, and spirit. And I believe that the synthesis of using our local Western herbs within this really very holistic, very well established older Chinese medical perspective can really help both traditions. So I wish everyone well, and I wish everyone well in these challenging times.